Welcome. I'm Joan Anderson with the Lancaster County Medical Society, which is the physician membership organization in Lincoln. We represent over 600 physicians actively practicing in our community, and in studio with me today are two of my members, Dr. Lisa Peterson and Dr. Dale Michels, both of which are family medicine physicians. Today and for a few months to come, we hope to present topics for you that are of interest to you on various healthcare issues. To do that, of course, we need to have input from you. So we've established an email where you can go and shoot us an email, tell us what kind of questions you might have for the physicians, what kind of topics you would like to see us address. And that email is talkswithdocs@lcmsne.org. Or if you'd rather just give us a call at the Medical Society, you can do that, and it's 402-483-4800. And before we get into the program, I do also want to tell you that if you have questions about finding a medical home, finding a physician, really any questions that you think we might be able to help steer you in the right way as far as resources, whether you have insurance or don't have insurance, feel free to give us a call at the Medical Society, and our staff is very well versed in a number of issues, and we can hook you up with the various resources in our community, which we're very fortunate to have a number of. Today's topic, we are going to talk about communicating with your primary care physician. Now, communications is a two-way street, so we're going to talk a little bit about what we expect of the patient or the client, but also we're going to talk a little bit about what we expect from you guys too. So starting with, can we tell the viewers how can they prepare when they make an appointment, particularly start with first appointment, never seen you before, I'm coming to you as a new physician. What is it that I need to bring to that appointment that's going to help the appointment go smoothly? Any ideas?
Well, first off, if it's your first appointment, when you call and make that appointment, I think it's a good idea if you ask if they have a health information form that you can fill out ahead of time. Okay. Take that in with you. That'll just shorten the time a little bit because it gives you time to think about, any surgeries, chronic illnesses, allergies, any of your past history. So that's number one. And then my front office would say, please remember to bring your insurance card so that they can send all that stuff away. It's not something I really think about, but they would. So, and I think it's fine to go ahead and bring a list of questions because oftentimes once you get there, you're anxious, nervous, maybe don't think about it. And I myself like to look at that list rather than having them ask me the list, because if they have chest pain at the bottom, that might be something I want to put at the top, prioritize there.
Okay. I know some offices now are requiring ID and actually taking a picture of you. Is that a new regulation? Is that kind of office by office? Do they need to think about bringing an ID with them?
I think it's kind of office by office at this point. As we eventually get more and more computer-based records, electronic health records, providing the information to the pharmacist, this is the person I wrote the prescription to, they can look at the picture. So there are a number of things like that. If you provide referral information back and forth, having a picture, knowing somewhat about the individual, not just their history, as Dr. Peterson talked about, but who they are. In our office, we typically just scan that information in, so we have it, it's available, it's transferred into the computer. So from that standpoint, I think it's good to have that kind of an information. Some offices may take your picture. The goal is to protect you as a patient. It's not necessarily that we are going to advertise who our patients are on the internet or anything like that.
But it really is. I've heard patients say, why do they need my picture? Well, it is really a protection for them.
It's a protection and an identification that I think is really important for them to have when they come. As Dr. Peterson said, finding the past history, having that information, going back and looking at your records. If you move from another community and you have your previous physician sent records with you, bringing them along is very important because the more information that we can take and build your record in our office, the better off we're going to do. To have to wait and go get that information from 3 or 4 or 5 different other physicians who may have seen you really takes longer and may slow down getting to the real problems that you're having and dealing with them.
I liked your idea, Dr. Peterson, of asking ahead of time. And I know some offices say, I'm going to send out a history and physical form for you to fill out and bring in filled out. The other offices may say, okay, you have a 9 o'clock appointment, check-in is at 8:45. And I think it's important that we talk about why that is, and that is to fill out the paperwork, so that if your appointment's at 9 but they ask you to check in 15 minutes early, because especially if it's the first time.
That doesn't happen, though.
It doesn't happen?
No.
And why is that? Oh, people don't show up?
Right.
Or
They
okay.
come. They don't come 15 minutes. Well,
Okay.
yeah. So I
And
think
not
it's
always.
better if you can fill
Send
that
it out ahead of
information
time.
out and bring it in with you.
Right. I
Yeah,
agree. I
yeah.
agree.
And maybe it'll take them longer than 15 minutes to fill
Right,
it out.
right.
So
Yeah, the patient who's had 36 different previous surgeries can't fill something out in 15
Right.
minutes, so they
Exactly.
need to come a little longer. The issue is, even though people don't think we do, we really do try and stay on time.
Right.
Well, that means we have to start on time. So if you come in just at the time of your appointment, but it takes 20 minutes to get all of the paperwork done, that makes me 20 minutes late before I can even begin to see you.
Right.
Well, you don't care because you're now getting to see the doctor. But the person that's coming after you, they do care because they got there on time and they don't want to have to wait 20 minutes because they've been coming to see me for 25 years and they want to be seen at 9:30 when that's their appointment, not at 9:45, 10, 10:30, whenever, you know.
So the key is preparation on our behalf, getting as much information ahead that we can give to you, and then your part is communicating that back to us as far as answering the questions, and we'll get into that a little bit. One thing I really want to spend some time on, because as I said at the beginning, we represent over 600 physicians, and at least 599 of them have called me about how can we get people to know their medications. Not just their prescribed medications, but over-the-counter medications. And what is your recommendation? I mean, yes, they'll fill it out on the sheet, maybe, particularly the first time, but what happens if I go to a dermatologist, or I have other people other than my primary care physician, or if I take over the counter? Why is it so important that you know that I'm taking an over-the-counter vitamin or fish oil or whatever it might be?
just because of the different interactions you can have with them.
Okay.
So, and I think keeping a card, in your wallet or purse that has the list of meds, and each time we see someone in our office, we go through all their meds, or my nurse goes in first, goes through all the meds, make sure they're updated, because sometimes they've seen a different specialist and they got prescribed one, and so we always have to be updating because there are interactions between medications.
There's not only interactions, but anymore there's the generic name and the brand name. And today I had one of my patients who said, I'm on such and such, and we looked at this list and I said, I think that's the generic for this. Oh, no, it's a different drug. Well, we looked it up and it was a generic name. So quite honestly, if it's your first time, or if you're on a lot of medicines and you've decided to take a lot of supplements maybe too, my advice is put them in a plastic bag, put them in one of these green shopping bags, bring them all with you. I know it seems kind of tedious, but you'll find that somebody says, well, I'm on this dose, I think. Well, it's 5 milligram instead of 10 milligram, or it's 50 instead of 100, but I think I'm on that one. Or they say, well, I'll call you when I get back home, which they forget to do because they were busy. So we honestly, you can bring a little pill box that you might use at home to administer the drugs to yourself because you can't remember whether it's morning or night and what days you take it. That's fine, but when you're coming, bring the bottles with and let us look through them. We can call the pharmacist, but they might have gotten a prescription from the other pharmacy because theirs was closed. There are all those issues. Bring them along. It's easy for us to go through and ferret them out. We find patients who say, well, I'm taking the same medicine, and then I don't know about Dr. Peterson, but I expect that often they've changed 3 different ones, but they thought they were taking the same ones because that was a couple months ago and they forgot that they changed.
Exactly.
Well, and the one thing you just mentioned too is, I've found when they bring in their bag of medicines, sometimes they are taking both the generic and the brand name, and they didn't realize it. So, so that's a good idea with
And
that.
I know, coming to you, that's one thing, but of my 599 doctors that have talked to me, many of them are emergency physicians. And they say, wow, you go to the emergency department and it's 2:00 in the morning. I can't get a hold of the pharmacy. you truly are in an emergency situation, and here you are, I have to spend 10 minutes or longer trying to figure out what medications you're on. So I really think it's important that we as consumers do carry a list. Carry the drugs, yes, but also if you have a list, in a previous life had worked in the pre-hospital setting. Our paramedics can get on scene, and we really need to know what medications you're on to be able to treat you well. So I really would like to encourage all of the viewers out there to talk to their family members, figure out how you can either make a list, certainly bring in your medications, but somehow take some personal responsibility for knowing what medications you're on, including the over-the-counter. Whenever you go into any situation, be it pre-hospital, in-hospital, or in the physician's office, time is just of the essence as far as figuring out what medications you're on. So I guess that's my little pitch to the consumer out there.
And along with that, know what your allergy is and what kind of a reaction. I think that's a very important thing. If people come in and they say, well, I had a reaction to this drug, whatever this drug is. You say, well, what was the reaction? Well, I itched a little bit, not necessarily a major concern. Oh, I broke out in hives, becomes a little more concern. Oh, I took it and I couldn't breathe. Major concern in terms of the drug. Or perhaps, it just upset my stomach. I could really take it, but it made me queasy and nauseated. And that's not really necessarily an allergic reaction, but it's an important thing for us to know so that we don't prescribe the medicine that's almost like that, that's also going to upset your stomach. So not only bring the drugs, but bring a real confident list of the allergy. And the fact that your mother said you were allergic to penicillin at 15 months because you got a little rash when you took amoxicillin for an ear infection, find out what kind of a reaction that really was. If a mom is still available or somebody, because a lot of times we could use those medications, we're just afraid to because they had an allergic reaction, which really wasn't an allergic reaction.
Right. And we're a very mobile society. So again, back to your list, if you're traveling anywhere and you end up having to go to an urgent care emergency room, having that list of what medications you're on, the dosage, when you take them, all of those things. So it's really like we wouldn't travel without our ID or our Visa card. So you really should try to talk among yourself and your family members. You know what? I really do need to have a current list of medications, including those over-the-counters.
Yeah, the idea that I take the pink pill doesn't really work very well anymore, and especially in the age of generics, because a generic, by definition, can't be the same shape and color as the brand name. So there are lots of those issues, and I think, as you mentioned, it's especially important. Take something simple as thyroid medicine. There are probably 10 different dosage forms out there, various milligram, various strengths. Well, we need to know which one that is, because if we change it to the wrong dose accidentally, we can mess up and cause a problem.
Okay, great. Dr. Peterson, you mentioned that you like to see the questions, and I wanted to ask, are doctors offended if I bring in my questions for you? Do you find that helpful? Is that something you like to encourage, Dr. Michels?
I think it's really helpful if they do. Like Dr. Peterson says, some of my patients bring in a page-and-a-half list. The issue for us is we may have limited time with that particular visit. So as Dr. Peterson says, if I can see your list and look and say, well, the fact that you want to talk about something that happened 10 years ago is not as high a priority as the fact that you've been having chest pain or the fact that you've been really emotionally down and having some problems with depression. The more list you can do, sometimes we can answer those questions very quickly rather than, oh, doc, I remember there's something else I wanted to talk about, but I can't remember it now. And then just as we walk out the door, they remember it, and it starts the whole process over again. So the list idea is great. Now, I'm sure there are some of the subspecialists who don't like the list because they really deal in a narrowed area and they have specific concerns. And they can't answer about your hip if you're there to see them about the rash on your arm.
But at you as primary care physicians also, I think it's something that we need to communicate to the audience is that if I'm making an appointment with you because I think I have sinus infection, that's not the time, because you haven't blocked off time to talk to me about my chronic back pain. That I know sometimes we've had calls from patients that say, they made me make another appointment because I wanted them to talk about my sinus infection and my back pain or whatever it might be. And it really is about time management, right?
It's not only time management, but sometimes we get patients who are frustrated because last time the bill was for X dollars. This time I saw you and it was for Y dollars, which was 1.5 times what. Right. Why such a difference? Well, they forgot that last time they came in just for the sinus upper respiratory infection or the red eye or whatever it might have been. This time they wanted to talk about their bladder and their bowel and their back and whatever might else be there. So it's those kinds of issues, and that takes us more time, and we try to be accommodating, but there are some limits sometimes, and that's why, as Dr. Peterson mentioned, if you have the list and you can prioritize it and say, I can't get through all 6 of these things today, but let's cover the 2 that are the most important for you. Let's get those and make sure we take care of those, and then we'll have you come back in a few weeks and see how number 1 and number 2 are doing, and then we'll deal with 3, 4, 5, and 6.
There you go. Okay. This is just an impossible question to answer, so that's why I'm going to throw it out anyway, is how often should I see my doctor? There really is no specific answer, but what are some guidelines?
Okay. Well, if you're talking more adults, we'll start there. That's where it's important, again, to have a medical home, so you can go in that first time and ask, with my history, my family background, my current diagnoses, or if I'm healthy, how often do I need to be seen? And we do have some specifics out there. We know women typically will start having pap smears age 21, or depending on sexual activity, and then every 3 years if the first 2 have been normal. But for men, it's not as specific. So I think, again, going in for that first visit and finding out how often do you need to be seen, because there aren't specific guidelines. It's more on an individual basis.
But it really is preventative. We want to see you before you come into us for a sinus infection, if possible. Really, that history and physical for a baseline is really important.
And you want, if a patient does have a chronic condition, you'd like to know that and know how frequently they deal with. Some of my patients with hypertension or high blood pressure, for instance, they do a regular routine job. They bring in their monitoring that they've done at home. I may not see them as often as the guy who says, "Oh, doc, I'll let you take care of it. I don't even check it." And so you really don't know whether their blood pressure is controlled. And blood pressure, hypertension is one of those kind of silent things. Until you have your heart attack or your stroke, you don't necessarily know you have high blood pressure. So it depends on the individual. And we talk about little kids, of course, there's a pretty well regimented schedule that's based on their development, based on their immunizations when they need them, and based on where we're likely to see problems. For instance, at 6 months, what are they doing? How are they interacting with their environment? How are they gaining weight? Are they gaining too much weight? Are they not gaining enough? Do they just lay there, or are they active? What kinds of things they're doing. So there's not only the exam, but there are those little developmental things that you see. My child at a year is not even trying to crawl. Makes us much more concerned than something else, for instance.
Right. We talked some about establishing a medical home, and I think that's a message that we should share with the audience, that it's not necessarily easy. Well, it's impossible. We get these calls frequently at the medical center. I need to see a doctor today. I think I have strep throat. Well, have you ever seen one? No, I haven't. But if you have established a medical home, if they're your patient or one of your colleagues, you're going to work them in. But if they have not gone and established a medical home with that baseline, that history and physical, they may end up having to access care through an urgent care or an emergency department. So establishing a medical home is important before you're sick.
Right.
And I think you've said it once that women do that much better than men. No offense.
There's no question about that.
So women in the audience, we'd encourage you to get the men in your life into a medical home, because it's just, you need to have, when you're well, you need to establish that home so then you can get in as soon as you...
well, and your medical home isn't just acute and chronic care, it's preventative care.
Right,
so,
exactly. Exactly, and that's where I'm sure we'll have a program down the road on preventative care, because that's huge.
It's very important.
Very important, and not enough time to talk about it in this session. One thing, that as far as communication that we get sometimes is, gosh, Dr. Michels has filled this medication for me for 3 years, and now the pharmacy says, I have to go in and see him. Why do I have to go in and see him? Or Dr. Peterson. Talk about that. You know, they feel like, can't I just call and get a refill of my Lipitor or whatever it is?
Well, first of all, I'd be very surprised for most of us if it had been 3 years. That's
1 year.
probably
Yeah,
a little
you're
long.
right.
Typically,
You're right.
it's a year.
Yeah.
The issue is that I feel a certain sense of responsibility that if I'm going to prescribe a medicine, I want to make sure, one, it's doing its job. Medicines like Lipitor or blood pressure medicines, you don't necessarily know that they're doing their job unless you test them. I want to make sure that you aren't having any side effects. We talked about knowing that, well, in the meantime, Dr. Jones or whomever started this other medicine, we want to make sure there aren't any interactions. So there are a number of reasons that we want to have regular follow-up with them and make sure. We also get notes from the pharmacist. Well, you prescribed this. Here's a year's worth of prescriptions, but they only filled 9 months. Is there a problem?
Right.
Can't they afford it? So we need to use the County Medical Society's program that will help them afford it, which we could talk about sometime as well. Are they just lazy and they don't take it? They're forgetful and they can't remember to take it. Well, then we might talk about some sort of medication reminder system so that they remember to take it. So there are lots of reasons like that that are important for us to make sure that our patients are taking their medicine in the right way. Some things require monitoring maybe every 3 months. Other things maybe twice a year, maybe once a year. It all depends.
So it's not like you're just wanting me to come in because you have nothing else to do. There really is a medical reason that you'll give as many refills as you possibly can until they need to be reevaluated. Okay, great.
Yeah, and some of those need lab follow-up too,
Right.
like the statin medications. So,
Right, right. Other couple of things that we hear a lot about, and I think in many of the forms that your primary care physicians have, is who is your, or do you have a healthcare power of attorney, and do you have a living will? I think sometimes we think about those two things for the older population, but that's not really the case, is it? So let's talk first about why do we need a healthcare power of attorney, and what does that mean?
Well, from my perspective, having sat on a committee that helped develop one for one of the hospitals, we kind of went through it. The idea is that if for some reason you can't respond, somebody knows generally what you want and is able to make those decisions for you on a legal basis, because that's really what we're talking about. And yeah, the young kids, everybody who's young thinks they're invincible. They don't have to worry about this. Well, we all read about young, invincible people who end up having something happen to them, and it doesn't kill them, thankfully, but it puts them in a point where they can't make any decisions for themselves. Now, certainly that's more common. My concern always has been, Joan, with a living will, you have to kind of outline what you want and what you don't want. So if there are 55 things you've agreed you want or don't want, it's always the 56th that happens to you. Whereas with a healthcare power of attorney, you have somebody who says, I understand what you want and what you don't want, and based on that and talking with your primary care physician, we can figure out that we know that you really wouldn't want this done, whatever this particular medical intervention might be. It's really the same thing as having somebody with the financial aspect to be able to pay your bills if you got into that situation. This is just for healthcare, which of course is our main interest.
Right. But again, you're going to need a copy of that because, for example, I'm a healthcare power of attorney of my parents who do not live in Nebraska. I can't just call up and say, this is Joan, my mother is so-and-so. They need a copy of the healthcare power of attorney, signed, dated, all of those things so that we've established that that's who I am. So it is a document that they need to have and share with you so you have it on file. Right?
And I think it's particularly true for the first responders, the pre-hospital care, as you talked about, for those individuals to know what you want done or what you don't want done, because when they're called into the crisis situation, recently, unfortunately, one of my patients who passed away quit breathing. His wife panicked, and in spite of the fact that he'd given her specific instructions of what not to do, she did it anyway in the panic situation, and it created, he didn't survive, but it created a lot of extra stress for her that was probably unnecessary. So it is really important that not only your physician have it, if you have a hospital that you always go to, that hospital should have it. Your attorney can have a copy. And it really doesn't hurt to let other family members know, oh, Joan's got the history. So, if your sister calls there or something else, there's some contact.
Right. Okay, good. We've talked a lot about physical care, checking the Lipitor and checking labs and all those kinds of things. But as family medicine, you don't just look at the physical care. You mentioned a little bit about that, but it's really important for me to be able to communicate to you maybe changes in my daily life that are stressors, that are, I've lost my job, I can't afford my meds. Those are as important, maybe more important than I'm taking an over-the-counter vitamin, right?
Right,
I mean, you need
right,
to know those
right.
things.
Yeah, and I would say in the last couple of years, that's been a big issue. But I would say probably 20% of what we see daily is going to be depression, anxiety, and sometimes just being able to talk about it. But we can also help with getting them extra help if maybe they just need a therapist to talk to, or maybe they need medication, or talking about diet, exercise. And another example, someone who comes in and says, I'm tired. Well, one of the first things I ask, well, how much sleep are you getting?
Right.
And it's amazing how many people say, well, 4 hours. Well,
No wonder you're tired.
Yeah. So.
Well, we could, again, go on, and fortunately we will have more programs to follow. There are a lot of takeaways just from this very short presentation. Number one is know your medications, write them down, take them with you. Communicate with your physicians, try to do that in writing, be as communicative as possible, and expect that from them in return. And I know that the physicians appreciate that two-way communication. So I would just like to close by, again, thanking Dr. Peterson and Dr. Michels for joining us, reminding you that if you have a topic for us to consider, questions, send us an email at talkswithdocs@lcmsne.org. If you need any kind of information about resources, Dr. Michels mentioned that the Medical Society has programs to help with getting free medications if you don't have insurance. We can help you find a medical home. Feel free to call us, and if we don't know, we certainly can give you some ideas of where you might call. And that number is 402-483-4800. Thank you for joining us.